लाइव सेशन का टॉपिक मुझे मिला है फ्रॉम द टीम. इट हैज़ बीन about secondary procedures that we do in the surgical field. So there is a very important term when we see secondary patients. Either they are not happy and satisfied by the previous surgeries, or they wanted something else and they have received something else post surgery, or their problem was so complex that they needed additional surgeries or the secondary procedure for correction of these issues. So if I talk about what are the common issues that we see when we see a patient who have already undergone a surgery, and then they come to us for secondary corrections or some revisions, or they would like to have another procedure for further enhancement of their results. So first of all, to all the viewers, I would like to mention that whenever you are seeking a consult for a surgery with your surgeon, try to be on the same page with the surgeon from the discussion point of view, that you have understood what the surgery is going to give you. So for example, if someone wants the correction of the फेस एंड जो हमारी बोन की डेवलपमेंट हुई है वो डिफरेंशियल है, फेस एसिमेट्रिक है, तो उस केस में अपने सर्जन के साथ थॉरली डिस्कस करें कि व्हाट आर द ऑप्शंस अवेलेबल टू करेक्ट द प्रॉब्लम. प्रॉब्लम किस लेवल पे है, बोनी लेवल पे है, सॉफ्ट टिश्यू के लेवल पे है, या कॉम्बिनेशन है, कौन कौन से ऑप्शन है जिससे कि इन प्रॉब्लम्स को करेक्ट किया जा सकता है. बिकॉज मेनी टाइम्स वी सी पेशेंट्स इन आवर सेकेंडरी कंसल्ट्स दैट उन्होंने अपने सर्जन्स को कुछ और बोला, उन्हें कुछ और डिलीवर हुआ, एंड देन दे वर नॉट हैप्पी विद द रिजल्ट. सो many times it is not the problem of the surgery, or the surgery is not botched, but rather there was lack in communication between the surgeon and the patient as per the expectation of the patient. So it is better to be on the same page with the surgeon so that you get the results that you desire of. Many times secondary procedures are needed if something is not done in the right manner, or probably it has not been done in a way how it would have been done. So for example, let's say someone wants an augmentation rhinoplasty, and then there are multiple ways with which we can augment the nose. First is conventionally we prefer using costal cartilage or rib cartilage to augment the nose. Per se, the patient was not willing for a rib cartilage graft, and he says, doctor, क्या कोई दूसरा option है? And the surgeon has used a silicone implants. Now what happens with these silicone implants that we use for the nose is they are bound to get exposed in long run, since the body is not fully accepting the implant. So in that case, the patient has to go another augmentation procedure through the rib cartilage to have a better dorsal profile and augmented nose, and we need to remove the implant. I see a lot of cases, particularly patients who have undergone previous genioplasties or chin implant, and they have not received a proper aesthetic profile even post surgery. So in these cases, again, it is important to understand what is the patient's expectation with the surgery and how we can improve the overall outcome of the surgery. So first is thorough evaluation of the patient. क्या चाहिए, कितना बोन के एडवांसमेंट चाहिए, क्या इतनी बोन के एडवांसमेंट उनके लिए अच्छी रहेगी, क्या बोन को एडवांस करने के बाद हम एक स्टेबल बोनी सेगमेंट को प्लेट्स की मदद से जोड़ पाएंगे, नहीं तो व्हाट अदर ऑप्शंस वी हैव. इज देयर अ ऑप्शन वेयर वी कैन यूज अ कॉम्बिनेशन ऑफ जीनियोप्लास्टी एंड चिन इम्प्लांट एट द सेम टाइम. So there are multiple ways with which we can try to figure out how and with what procedure we can deliver the result that the patient is willing for. Many times patient do have unexpected expectation out of a surgery or unrealistic expectation of the surgery. So in that case also, being a surgeon, it is my duty to tell the patients कि क्या चीज़ possible है और क्या चीज़ नहीं possible है. So for example, many times I see consult and they say कि डॉक्टर मुझे 2 सेंटीमीटर 2.5 सेंटीमीटर का एडवांसमेंट चाहिए चिन का, क्या ये आप कर पाओगे? सो सी, प्रैक्टिकली इट इज नॉट पॉसिबल टू गिव अ 2.5 सेंटीमीटर ऑफ एनहांसमेंट ओनली विद जीनियोप्लास्टी, बिकॉज अगर हम बोन को इतना आगे कर रहे हैं तो हमारे पास स्टेबल यूनियन के लिए स्पेस नहीं है, या बहुत ज़्यादा गैप क्रिएट हो रहा है दो ऑस्टियोटोमी साइड के, जिसके बीच में बॉडी बोन नहीं बनाएगी. तो इन दैट केसेस वी नीड टू गिव द रियलिस्टिक एक्सपेक्टेशन टू द पेशेंट कि एट मैक्सिमम वी कैन गो अबाउट 1.5 सेंटीमीटर. बियॉन्ड दैट वी need to use additional bone graft if you are looking for the same. But there are other ways with which we can give you a good advancement. For example, combination of bilateral sagittal split osteotomy along with genioplasty can give you the desired result. Now again, many times we see patients in our consultation who have come for facial implant removal. So for example, someone has undergone an angle implant and they're not liking it, or someone has got cheek implants done and they're not liking it. In that case also, we need to do a revision surgery or a secondary surgery to correct that. Sometimes it is not the problem with the surgery, but patient has undergone additional trauma post surgery, which has led to fracture of these implants or fracture of the plates or the osteotomy site, or because of trauma there is again some sort of asymmetry to the face. So in that cases also we need to re-intervene to correct the problem and give the result to the patient. We see a lot of patients who have already undergone jaw surgeries, and then they're not happy post-surgery. They feel some tightness. They feel that there is again some cross bite or difficulty in chewing. So in these cases, again, it is important to understand the entire mechanism of jaw surgery with the surgeon. You need to understand what alignment is possible with the bone mobilization, what planes can be corrected, to what extent the surgery can help you. Also, before undergoing any procedure, patients are requested to understand how beneficial that particular surgery or that particular treatment is going to help you out in a manner whether it is totally beneficial for you or not. So again, there are a lot of aspects of understanding these things so that you don't land up in a situation where you're again looking for a secondary procedure or a surgeon who can help you out with the secondary procedure where you can get the problem sorted out. सो देखिए बेसिकली प्रॉब्लम क्या होती है कि जब हम फ्रेश टिश्यू, जो कि हम प्राइमरी सर्जरी के टाइम पे जब हम ऑपरेट करते हैं, तो टिश्यूज में क्योंकि स्कारिंग नहीं होती, फाइब्रोसिस नहीं होती, तो टिश्यूज को एलिवेट करना, कट करना, मोबिलाइज करना हमारे लिए ज़्यादा आसान होता है एज कम्पेयर टू इन सेकेंडरी प्रोसीजर्स. बिकॉज सेकेंडरी प्रोसीजर में बॉडी क्योंकि स्कारिंग के माध्यम से हील होती है, फाइब्रोसिस होती है, तो मोबिलाइजेशन, टिश्यू एलिवेशन, वैस्कुलरिटी, सारी चीज़ें थोड़ी कॉम्प्रोमाइज होती हैं, जिसमें कि सेकेंडरी प्रोसीजर्स हमेशा थोड़ा ज़्यादा टाइम लेती है, थोड़ा ज़्यादा कॉम्प्लिकेटेड होती है एज कम्पेयर टू प्राइमरी सर्जरीज. बट अगेन सेकेंडरी सर्जरीज आर पॉसिबल, बट अगेन द इम्पॉर्टेंट पॉइंट इज a thorough discussion with the surgeon, taking in consideration all the relevant points pertaining to that particular procedure. Many times patient do insist कि डॉक्टर मुझे एक ही सेशन में सारी चीज़ें चाहिए. So for example, if there is a complex problem like if we have someone who has a TMJ ankylosis with facial deformation, so there are multiple ways with which we can treat these patients. For example, we can opt for a total joint replacement of the jaw joint followed by an orthodontic surgery. In some cases, we can combine joint replacements with orthodontic surgeries. There is also a very good option of doing distraction osteogenesis, that with the help of distraction we can regrow the bone and we can take care of the facial profile, and then we can treat the joint separately. So again, there are some parameters that we take care while planning these cases. For oncoresective cases, people who have undergone primary resection and then after radiation and all, they think of rehabilitation. So in that case, secondary procedure can be done for reconstructive work where the jawbone or the missing part of the jaw can be recreated with the help of the tissues from another part of the body. Many times people have undergone resective surgeries and then they look forward for reconstruction for functional rehabilitation. So in those cases, a free fibula graft can be utilized to recreate the bone structure, followed by dental implants placed in those bones. so that the functional rehabilitation can be restored. With advancement with 3D planning and everything, now there is a possibility that we can recreate the joint with the additional bone which has been resected out during the primary surgery. So कई ऐसी surgeries हैं, कई ऐसी चीज़ें हैं जो कि हम plan कर सकते हैं. बट अगेन इम्पॉर्टेंट चीज़, मैं बारी बारी सारे पेशेंट्स जो मेरे पास कंसल्टेशन के लिए आते हैं मैं उनको यही बोलता हूँ कि डिस्कस इट आउट थॉरली. देयर इज नो हरी इन डूइंग एनी सर्जरी. If you are in doubt, you can always have a reconsult, you can go back, you can read about it on various social platforms, like you can go on Google, you can search throughout कि एक particular surgeries के क्या advantage है disadvantage है, because once you read and have a little information about it, you can always come back with doubt and you can clear out with the surgeon. So that is the approach I follow. I ask the patients to have a primary consultation. Since I practice a lot of maxillofacial things, so CT is mandatory in my practice. I get CT scan done for all the joint, bones, jaw cases, so that we are able to visualize both the soft tissue and the hard tissue, how to plan it. I often recommend my patients to undergo 3D planning in case we are doing some bone advancement, genioplasty, or they want to be sure how they would look post surgery. So they give an idea to the patient with the 3D planning that how they're going to look post surgery. If they are satisfied by the primary consultation, then they are asked to read more about the surgeries, about the complications, so that when they come for the secondary consultation before the surgery, I am able to explain it in a better manner ki if there is a nerve paresthesia in jaw surgery, how long it is going to stay, how I can help you in the recovery process, what are the due diligence taken during the surgery so that paresthesia doesn't happen. If it has been there, what things you need to follow in the post-operative care so that you heal fast, you recover fast. So there are many things like these that needs to be understood before you undergo the knife. That I mean by undergoing any surgery. So again, many times people have undergone a wonderful surgery at some other place, and then they come and they say, doc, I think my surgery has been botched up. But it is really so again, the problem is somewhere there was a gap between the discussion part between the surgeon and the patient, and patient expected a certain result in a certain manner which they were not able to get post surgery, which has led them to find another surgeon, look for another place where they can get it corrected. So guys, if you have any questions pertaining to secondary surgeries, maxillofacial surgeries, plastic surgery, you can always ask us in the comment box. You can connect with us on our given numbers, you can mail us, you can always share the photos with the team so that they can come to us for a preliminary examination of those photographs, and they can revert you back with the queries that you have asked. So again, with the advancement in the maxillofacial surgeries, the number of secondary procedures have greatly reduced, but it has not been completely out of the scene. So yes, people do opt for secondary surgeries for corrections, for further improvement, for further enhancement. Even in some cases, patients do opt for secondary treatments for the reversal of the surgery. So let's say a patient who have undergone a Lefort 1 surgery for the advancement of the upper jaw, since they have a complaint that the teeth are not visible, they have a very flat smile, they don't look very aesthetic while they smile, they hide their faces, and they have undergone a Lefort surgery for the same, and from the result point of view, the surgery was fantastic, the stability of the bone post surgery was fantastic, but then also the patients were not able to comprehend with the result, and they felt that it is something which is not suiting their face, and they want a reversal. So there are multiple instances where patients want it a certain way and they are not able to get the results they want, and then they look for secondary procedures. So what are the challenges that we face while doing the secondary procedure? For minor procedures, it is as good as primary surgery, but for major thing where bijaw surgeries has been done or angle ostectomy have been done, we have seen a patient who was operated for lower jaw contouring, and there was over resection of the lower jaw bone. So if you see, this is the mandible, and this is the angle area where we operate for the lower jaw contouring to make it more V-line, and the patient has over resective lower angle, which led to the damage to the inferior alveolar nerve. This is the nerve which supplies the lower jaw, lips, and everything. So this was the area. Because of the resection, the nerve was damaged. There was permanent anesthesia of this nerve, which led the patient to consult for a secondary correction, and there was hollowing of this particular area because of the over resection. The masseter muscle and the soft tissues were completely inside of the lower jaw, which gave a big dimple kind of a thing here to the patient. So in these cases, again, we get a fresh CT scan done to see what is the current state and how could we correct these things. So this could be corrected with a patient specific implant, where a customized implant can be placed to correct the over resective bone. And for the paresthesia, definitely it needs a reconstruction with the nerve graft, so that the patient is able to get the sensation back. So again, important thing is to have a thorough discussion with the patient. Even as a surgeon, I prefer to have a thorough discussion with the patient, discuss all the relevant points, discuss the complications, and then we can opt for the surgery. Now, as I was mentioning, what are the complications or the challenges that we can encounter during the secondary surgeries? So in bigger cases where there is a lot of scarring and fibrosis, particularly if we are operating from inside, or let's say we are doing a secondary rhinoplasty, so there is a lot of fibrosis and skin thickening present in these cases. So as a surgeon, we prefer doing a meticulous dissection, so that we are able to not to damage a lot of structures or the mucosa. We take care that the flaps are raised as good as in the primary cases, so that we are able to resuture the area well. There is no sort of wound dissense in post-operative phase. There is no secondary complications pertaining to that particular revision surgery. Now, recovery wise, it takes a little more time as compared to the primary surgeries. So for example, if someone who has gone a primary rhinoplasty, we tell to our patients that the mean recovery time is for complete result is about 6 months. For patients who have undergone secondary rhinoplasty, we tell them that the rhinoplasty may take about 1 year to 1.5 years to show you the complete results. Again, because there can be a little more edema, a little slow overall healing time for the patient. So recovery wise, it is little slower, not in all the cases, but in some cases it can be a little slower as compared to the primary surgery. So again, when we talk about secondary procedure challenges, the other thing is what if someone is looking for a reversal surgery, is it beneficial to do a reversal surgery versus not doing it, has to be considered while doing a discussion with the patient. So again, looking for the pros and cons of a particular procedure, we take a call whether we should do it or we should not do it, or is there any way. So someone is asking, sir, bone grafting is good for cheek augmentation. Yes, bone augmentation or bone graft augmentation with the bone graft is one of the viable options for cheek augmentation. But again, we need to consider the fact that because since we are using avascularized bone for cheek augmentation, there is some amount of resorption associated with these kind of augmentation. So for high cheekbones, we can have a silicone implant that is pre-made or prefabricated, or else we can get customization done with PEEK material or silicone, or with titanium customized implants. We can make the cheekbones look high, and it can be well positioned to make the cheekbones higher. So as I was discussing about the recovery time in secondary cases, so in my experience, we do a lot of silicone implants, and I prefer doing it because relatively it is an easier procedure to do, fast recovery, and it gives you one of the best results for cheek augmentation. So there are a lot of candidates who opt for cheek augmentation with silicone implants. So again, coming back to the recovery time, so yes, certainly the recovery may take a little more time. So what is different in the post-operative care between the primary surgery and a secondary or a revision surgery? So mostly the post-op management remains the same, the medication remains the same, the instructions that are given remains the same. It is just that in both the cases you need to be vigilant about the healing process. You need to visit your surgeon regularly. You need to be on regular follow-up, so that if there is something which can be managed at early time can be done. So for example, if someone has undergone a rhinoplasty, so people who have thick skin, they have a more tendency for fibrosis and scarring beneath the skin. So we prefer doing post-operative management with some injections in these cases. So for yeah, there is a question. Have asymmetry in my cheeks and bone with and lower jaw as well. So if you will connect with my team, I can ask them to share a picture with you of a patient who got operated with us. He had asymmetry of the left side, and we have wonderfully corrected it with implants. So we did an angle implant of the left side with a cheek implant, and some fat grafting was done to restore the asymmetry. So yes, as I was talking about, what is the importance of visiting your surgeon regularly on the follow-ups in the post-operative phase. So let's say there is excessive fibrosis, and we feel that fibrosis is going to happen if we do not intervene at the right point of time. So we do some injections. We tell how to massage. If there is a need of silicone gel application, particularly for external scars, or if there is anything that needs to be done to treat the hyperpigmentation, since the Indian skin type is prone for post-surgical or post-inflammatory hyperpigmentation, which is otherwise called as PIH. So there are multiple factors that is governed in post-operative phase. So many times patients are reluctant to visit their surgeons, stating the fact कि surgery तो अच्छी से हो गई, अभी मुझे कोई दिक्कत नहीं लग रहा, I should not go for the follow up, or it is okay, let's skip this time, we can go some other time. So this is a personal advice to all the people who have undergone any sort of surgery or any sort of treatment, that they should regularly visit their surgeon as per the mentioned duration or timing during this surgery. So for example, if someone has undergone any pathological correction, so why follow-ups are important? So yes, post cheek implants, you can definitely resume your physical activities after 6 weeks. There is no issue as such, and the only thing is that you need to consider that post implant, if there is a strong kick on your face while doing karate, it may dislodge or damage the implant, which you might need to replace. But generally, it doesn't happen. But in cases where there is extensive trauma or a force full impaction over the implants, it may just fracture. So what I was saying, why post-op follow-ups is important. So for example, if you have undergone a pathological surgery for a pathology, or let's say something like a cyst or a tumor, or for carcinoma, so why follow-ups are important is so that the surgeon can keep you on regular follow-ups and see if there is any secondary growth or any secondary tumor or any secondary cyst or any secondary carcinoma which is being is it growing or not. So it is important to be on the follow-up. People who have undergone jaw surgeries, rhinoplasties, why is it important? First, to consider how the overall healing is. Second, there is something called as relapse in jaw surgery. Although with the advantages of the microplate now, or the mini plates that we use, these the rates of relapses have reduced significantly. But then also you need to be in connect with your surgeon for regular follow-up so that he can monitor you if there is any sort of change happening. And this helps you with having a stable result in longer run. Once the complete ossification and bone healing has taken place, then it is not needed. So the general follow-up that we ask for the patient to be with us is, if we have done, let's say, surgery today, we have discharged by tomorrow. The third day we call for initial inspection. Depending on the area, between 5th to 10th day we remove the stitches. Then we call on the third week for jaw surgery, since the third week is an important week because we remove the intermaxillary fixation if there is one. And then later on, after a month, 3 month, and 6 month, by the end of the 6 month, most of the bony reunion has happened and calcification has happened, which helps you to give a stable result. But for the first 6 months, I expect my patients to be on regular follow-up so that we are able to help him out if there is any undue change that is being seen in the post-operative phase. Similarly for rhinoplasty, similarly for implants, similarly for reconstructive work, similarly for hair transplant that we do. So again, it's a big topic about secondary surgeries, and I cannot cover all of them in one live session. But definitely, if you have a question or a doubt, you can always ask us in the comment box, or you can connect on the numbers given on various social media platforms. You can connect with us on email. So we feel happy to answer all those queries so that you are able to make a right call, right decision about the surgeries, how you want to get it done, when you want to get it done, and what are the possible complications that you may encounter post surgeries. How a surgeon can help to reduce these complications so that you have an uneventful healing in the post operative phase. So and the same thing goes for the non surgical treatment as well. We we see a lot of patients from the non-surgical point of view who have undergone fillers priorly, and they're not happy with the results, or they have gone some non-surgical treatment such as HIFU for something and they are not able to get the results, or then they have not been able to address the problem that they have complained of. So again, the most important point is thorough discussion with your surgeon. Second is, be on the same page before you opt for any treatment. Third thing, follow all the instructions that have been given by the surgeon so that the healing is uneventful, you get a satisfactory result. And four, how long does it take for plate expansion? I'm sorry, I'm not able to get your question. Is it pertaining to jaw surgery or fixation of the plates that we do? If you can ask me in a little more clearer way, I would be able to answer that. So yes, as I was explaining, be on regular follow-ups so that the surgeon can take care of your post-surgery events. And yeah, so that's all about secondary procedures. Even after that, if you feel that you're not able to get the result that you were looking forward to, don't look for another surgeon initially. Go back to your surgeon where you have got yourself operated, so that if there is a way out or he or she can help you in a better manner, he will be able to do so, because the surgeon who has operated on you knows the best about you at that particular time. But let's say in certain cases, if the existing surgeon is not able to help you out with the complaint that you have, you can always seek for a secondary consultation, a second opinion. And we are open to all sorts of discussion in those respects. So thank you guys, thank you for joining this live session. I feel happy when I connect with you on these live sessions, and I'm able to give you valuable inputs from my side as a surgeon, and how I can make you help in taking a decision pertaining to a particular surgery. And maxillofacial surgery itself is a very what I say is a very is a branch of a Magnus level where multiple things are being done, operated, treated. So again, look for a surgeon who is, or rather, look for a center which is well equipped with the recent advances, so that you are able to get the benefit of the surgeon of the advances to get a proper result. So thank you guys. Thank you for joining this live session. Would love to see you again on such live sessions. So see ya. Bye.